Today, I'm really excited to learn more about the two special guests that we have today. Um, People are coming in, people are joining, but I'm gonna get started here. So, for those who don't know me, my name is Priscilla Fletcher. I am the founder of Latinos in Success, which is a community that provides resources and support to Latinos and allies in customer success and tech. We've been working, we're about to celebrate our first anniversary next month. So, it's been a year since our first live event. We have a lot of fireside chats, YouTube pages with videos, bite-sized workshops, and a lot of other things in our Slack channel where we collaborate, mentorship groups. And I also have my co-host here today. He's part of our squad member, Joey Medrano, but I'll let you introduce yourself.
Hi, everyone. My name is Joey Medrano. I am so excited to be co-hosting this with Priscilla and with Latinos in Success. But most importantly, the reason why we're here today is really to just talk about how AI-driven solutions are really helping families navigate this digital well-being landscape. And we really wanted to talk with Nick Manzak, who is a co-founder and CEO of Elomia, and Bill Brady, who is a co-founder and CEO of Troomi. And so they are at the forefront of this field, and they're using this technology to make safe spaces a supportive digital experience for both children and families, and doing it through a multitude of means. Myself personally, I actually use Elomia, and it is available in Spanish. And so it's just something that is really near and dear to my heart to see how we can continue to best support families of just different lives. And so with that, I wanted to pass it over to Nick for a brief introduction.
Yeah, thanks, Joey, and excited to see everyone and excited to keep growing this partnership we have with Latinos in Success. Like Joey mentioned, I'm one of the co-founders of Elomia. We've built an AI chatbot, again, fully powered by AI for mental health support. So if people can't get access to a therapist or they just want to talk through what they're going through with a tool, that's where Elomia comes in. And we have an amazing partnership as well with a cell phone company called Troomi. And for that, I'll turn it over to Bill, the CEO and founder.
Great to be with everyone. Yeah, I'm Bill Brady and the CEO of Troomi. We're the kids safe phone for digital wellness and positive mental health. So really trying to keep kids out of all of the dangerous stuff out there as they use cell phones and help them to maintain positive mental health. I think digital safety and mental health are inextricably connected, and that's the mission that we've embarked on. I'm also a dad to 5 kids. Our oldest actually is turning 21 today, and our youngest turned 9 last week. So I've got still the whole gamut, and like all the parents in America, our family's working through all these questions with kids and tech and mental health.
That's awesome, Bill. Congrats. I was gonna say that because I saw one of your interviews and I remember you mentioned, I don't know how you do it with 5 kids. I have three, but also similar situation. The youngest is 3 and the oldest is 16. So very different. By the time the youngest is 16, right, we're gonna be in a different time. Everything's gonna be different already. So always trying to learn. And thank you for joining us. I know you guys are busy. I know you have a lot going on. Thank you. I appreciate your sharing and I appreciate our partnership as well. I think when I met Nick, we bonded over the fact that we care about mental health and we care about people. People come first to all of us. That's the reason why I started the community. And that's why I mentor and I coach a lot of people. And that's why the partnership makes sense because we care, especially in our community where minorities, right? Like we've been trained our whole life to do certain things. And then all of a sudden you have to change because you want to continue to grow. So mental health, it's really important. So I'd love to start this conversation. If you can talk to us a little bit about the partnership, the story behind the partnership, and why Trumi reached out to Elomia and how that everything started.
Yeah, I'll weigh in on that. So we got into market a little bit over 3 years ago. And, all of our core functionalities really focused first on digital safety. It's keeping kids out of pornography. It's keeping them away from predators. It's keeping them away from bullies. And that's every parent in America would agree that those are essential things. And I call those the obvious dangers of kids and tech. But we're seeing now some very also clear dangers that are a little bit less obvious. And that's the alarming spikes in stress, anxiety, depression, loneliness, isolation, just all these negative mental health outcomes for kids that are now very clearly and directly correlated to screen time and social media and some of these other factors. And so our mission has always been to help parents raise happy, healthy, confident kids. And we knew that digital safety is the first step. If you put it into clinical terms, I call that prevention. But we also wanted to help parents have insight into how their kids are doing. And we had the vision of creating a mental health chatbot that kids could talk to anytime and have that help and receive that anytime, anywhere in a safe way. And then also give parents insight into their kids' predominant emotions and in the things they're thinking about and worrying about. And as we set out to do that, it became clear that Nick and his team at Elomia were going to be a perfect partner to help us develop that.
Yeah, and I'll touch on it as well. I think when Troomi reached out to us, it was not a market we were thinking a lot about at that time, but the more we thought about it and heard about why they reached out and the issues and the work they were trying to do for the users, the kids on their phones, we started to realize that it would make a lot of sense. And I think we've all had different journeys in mental health and all had different upbringings. And I think we see the value of if you can teach kids critical thinking skills and problem solving skills earlier on in life, it can prevent so much down the line and set them up to be even better human beings. So we were really excited when they reached out and in what this partnership could become.
Thank you both for sharing. And really, I'm super curious as for you all to talk about a little bit more about the solution that y'all came up with together and working together and really how you are able to integrate things like AI to support children's mental health and families and just the balance of technology in general. I just saw like a TV show the other day where it's just like, no tech Tuesdays. We're not doing it. We're not touching technologies on Tuesdays. So I'd love to learn a little bit more just how the solution you created and then also just how you're integrating all this technology into the family households.
So the chatbot is called Trudy, and Trudy interacts with kids using SMS. So right there on their Troomi phones, they can talk to Trudy anytime and just reach out with a question, reach out with a concern. Trudy also through SMS gives kids conversation prompts. And something that I love, and this was really important to us as we were working with Elomia, is that it's very positive. So it's very positive feeling. So it doesn't assume that a child is in distress. It asks questions or gives conversation prompts, and it could lead to a completely positive, upbeat conversation. Conversely, if a child is going through some tough stuff, then they have the opportunity to talk about it. And the chatbot is very safe. It's very guardrailed. Parents have got to realize that kids are already using AI to ask questions, whether that's ChatGPT or Character AI or any of these other things that are out there. And if a system isn't guardrailed, then the child could be getting all kinds of information or suggestions that the parent wouldn't be aligned with or want them to have. And so I always say to parents, hey, kids are already doing this. Our goal was to create something that would be safe and positive and uplifting and have interactions that help teach kids critical thinking when it comes to their emotions and emotional resiliency and problem solving. And Trudy is very much like that. It's not going to discuss topics that are inappropriate, and it's going to give parents through the Troomi parent portal where they're already going to manage the device and understand their kids' digital habits. Right there, they also now have a mental health dashboard that helps them see how their kids are doing. And it's game changing in what Elomia has helped us to build.
Yeah, just quickly, I'll double down on not every child is going through a mental health crisis. So we work with adults in different forms of our business at Elomia, and they come to us because they're usually working through something. But like I said, not every child, like Bill said, not every child is going through something. So I think we've changed certain things in the way the conversation works and will allow children to go. And again, users 8 all the way through 18 use Trudy. And so sometimes a child might just want to play in a fantasy role play where they get told a story and they're involved in that story and the AI goes back and forth. And the story still has an underlying, like a through line of them learning a skill, them learning a lesson, again, with that slant to positivity and growth. And so again, children are already going to AI tools to talk and ask questions. Why not make a tool that is going to be safe, it's going to be guardrailed, and it helps teach these concepts in a really fun way.
Yeah, and this is great. And it makes sense because it is true. And I even tell my kids, if you're not testing this right now, you're going to be behind. So you might as well start using it. Just like I used the examples, they weren't allowed to bring calculators or dictionaries to school, and now they're mandatory, right? Like they have to bring a fancy calculator to school, otherwise, So it's one of those things I try to push them to at least get familiar or be exposed to. Can you talk to us a little bit about some of the stories behind some of the results that you're seeing, things that can help us understand a little more, like how kids are using, but also what parents are seeing?
The feedback we're getting from parents is really positive. And I always tell people, and we make it clear in our marketing, that Trudy is not intended to be a therapist. It's not a diagnostic tool. It certainly doesn't take the place of parents. What it does do is give kids the ability to ask questions and express feelings and get advice anytime, anywhere. And on the back end, where parents have the insights into the things that their kids are thinking about or worrying about or working through, parents have expressed it gives us a fantastic touch point to connect even better with our children. And I'll give you an example of that from my own experience. We have a 15-year-old daughter who uses our product, and very tragically, friend of hers died by suicide at the beginning of this school year. And our relationship with our daughter is such that she immediately came home and, talked to us about it. And my wife and I made a very concerted effort to talk a lot over the next few days and just see how she was doing. I was surprised that even after she had stopped talking about it, it showed up in insights from Trudy that she was still thinking about it. And it gave us as parents, the ability to have that understanding and go back and say, hey, how are you doing? It's been a month. How are you doing with this tragedy? And even consider, do we need to look at getting some additional help? We hear from other parents that, again, they see the insights that come from Trudy, and in no way does it contradict what they would say or think as parents. But it's like this other voice that the kid is happy to listen to. It's not detracting from the parenting experience, it's adding to it. And it's not detracting from the relationship with the child, it's adding to it. And we've had some neat experiences hearing about specific examples from families.
Yeah. I think it's just another place where they can go and get advice. I love hearing the stories of, we've all been teenagers. Sometimes they're asking Trudy how to get their high school boyfriend to kiss them, or how to ask out a girl to a dance. These are all normal stages that everyone goes through. And Trudy has the ability to provide really safe, good advice that when parents look at it, they're like, yes, this is the right advice that I want them getting, not their other teenage friend giving them bad advice. So it's just a good place to go.
There was a story of one of our users. This family moved, a cross-country move, and this teenage girl found herself in a new place without a new home to move into yet, and just that whole process of having to make new friends, and an anxious time for someone who's 13 or 14 or 15, right? And this family talks about how great Trudy was at just helping this young woman work through her questions and her feelings, and really smoothed out this process where she was feeling, out of place, and there were a lot of questions in her life. And we love hearing things like that. And in that process, the parents' feedback was, how great was this? And the insights they got added to their ability to help their daughter. Trudy didn't replace them in their responsibility to support their daughter.
I love hearing like stories like this, and it makes me think back to even myself growing up, and just the moments that like I felt shame for like no reason. Like I would just be like, "Oh, I don't know if I could talk to my parents about this." But like it was a real thing. I didn't know who to talk to. And even nowadays, like it was already mentioned, people are already using these things. They're going to Google or they're going to ChatGPT and they'll be like, "Hey, I feel this way about something. I made this terrible joke at lunch. Like, why am I still bothered about this joke?" And so I love that, knowing that there are things like this that are available to them. And really, I want to kind of look forward a little bit and talk about y'all's vision for advancing AI solutions to really support mental health and safe tech use. I know that anytime AI is brought up, for some reason, Skynet is always like the number one thing that people go to or think of. And so I was really curious about y'all's vision for how you're looking to build this type of solution out as times change.
Nick, why don't you run with that?
Yeah, I'll run with that one. Obviously, we have a vision with Trudy, and that one starts with continuing to make it more valuable for kids. Like we talked about, they're not going through the same issues as adults. And so we're looking to continue to improve the model. We can get a little nerdy on AI. The way you start to improve and change these AI models is a kind of a learning process for the model. And so when you see these conversations in the transcripts with users, we basically have our clinicians go in and rewrite certain messages, say this was a good conversation, this could be improved in this way. And as you do that over and over again, the model starts to change the way it behaves for certain user groups. And so that's really what we're excited to do with Trudy kind of down the line. And over time, it'll just continue to be a conversation that works a lot better for the different age groups. But then also just is more engaging and allows them to dive a little deeper. And then I'll touch a little bit on just AI down the road for everyone. Is we're looking into the two big things that I think will change a lot of the game of AI, but definitely in the mental health field, is bringing in memory. So being able to remember a whole conversation. It's not so much about we can store as much data as we want. We have large data centers. It's about being able to use AI to reason what are the important pieces in everything we've learned about this user to bring into the conversation now in the live setting. And so that's like the reasoning piece that there's a lot of different people all across the AI industry that are trying to figure that one out and get it right. And I think we'll figure out a way to get it right, and that will be a really compelling experience for any kind of user.
Yeah,
Thank you so much. Well, I think we're at the part where we wanted to do our interactive Q&A portion. And so if there are questions in the chat, which I see we have one, or if you want to, come off mute and say it, like that is totally fine too. I'll go ahead and read this first one, but everyone else just please feel free to come off mute if you have any questions. So for this first question, this comes from Olha. She says, how can we help children navigate the complexities of social media and online interactions, including gaming? I have to mute everybody whenever I play games. So I totally understand that. So please, Nick, Bill.
Yeah, I don't have kids yet, Bill, so maybe you take this one first.
Well, I'll be just brutally honest. I think that we have to be very intentional about making sure that technology is a valuable tool. Our kids need to learn how to use it, obviously. They can use it for learning, they can use it for creativity, they can use it for connections. But it's very, very easy to let that run amok and see the technology turn from being a tool into being a tyrant. And as soon as the technology isn't serving us and it feels like we're serving the technology, we've lost a lot of ourselves as humans. So I encourage parents to be very, very intentional. Social media, I feel strongly about that younger kids should not be using social media. It's where so many of the problems begin with pornography or other content addictions. It's where there's exposure to the comparison culture that's destroying the self-esteem of our young people, especially girls. And I'm very aligned with Dr. Jonathan Haidt, who wrote the book The Anxious Generation last year. And his advice is delay that stuff, delay it. Do not give young kids social media. So on Troomi devices, there is no social media. We feel that strongly about it. And same thing when it comes to gaming, be very, very intentional about the amount of time that's allowed. If there are games on a device, limit the time that they can be played, when they can be played. And as a parent, there's no technology that abnegates our responsibility for keeping an eye on things. And on our platform, for example, we help parents do that. We help them keep an eye on things, but don't ever just say, here's the technology, good luck. That's not the right way to go.
Yeah, I agree. Even with the different age groups that I have here in my house, I see how different they interact with technology and even AI now. I'm curious to hear like how you all think about, I think we had this conversation before with Nick and Joey, like how you think about AI and therapy helping and supporting minorities and people that don't normally have access to therapy. And even for us, like we were raised in a very different way, like how like, you know, our parents taught us how to do and how to have a voice, and how do we want to raise our kids in different times. How do you think about that? And I know you are thinking about it because you even have the app is available in Spanish, so I'm curious to hear how you think about it.
Yeah. I like to say sometimes for Elomia as a company, we're trying to break two stigmas, a stigma around mental health and a stigma around AI. And I wouldn't recommend a startup try and break two stigmas at once. But here we are. And so that's what I think of when you're talking about, you know, different things in culture. Countries behave differently with regards to mental health and therapy. And so again, we're not a substitute for therapy. We just want to be another access point for people, a tool that they can use, and potentially a gateway to some of these things. Some people are not ready for therapy, but do want to work through some of these things and feel more comfortable talking to AI instead of going straight to another human. And so some people come to us, start talking about what they're going through, and then they actually feel more comfortable reaching out to people close to them or reaching out to a therapist. So we're starting to see it's a really nice gateway. Also for people that typically, again, there's that stigma, they typically don't go for cultural reasons or kind of anything else that's on their mind. Males are another one where typically live human therapy, it's 70% females as clients, 30% males. With our app, we actually see 50-50 split between male and female. So it seems, just based on that stat, that males are more likely to engage with AI. And then, like I said, could be a great gateway into talking about these things with the people around them and or seeking further help. So it just seems like it could be, and what we're seeing is it is an easier way just to get into these topics that people might not know about, to learn concepts from Elomia, ChatGPT, different AI tools, and then feel more comfortable bringing them up in live situations with the, you know, friends, relationships, and then potentially therapy.
Yeah, my mom has just yesterday told me to pull myself up by my bootstraps. I'm from Texas, so that is a very common thing to hear, especially in my Latino household.
One
Yeah.
more, another joke sometimes we'll make is that men are more likely to build an AI therapist than go to therapy. And again, just a joke, but there's some truth in it. And so yeah, we're there as an option for them.
You got the data to show it. All right, we have another question in the chat. Does Trudy support live calls? Kids nowadays also struggle in writing and expressing themselves. So how easy is it for Trudy to understand a child?
Really easy, actually. And we don't have a live call feature at this point. But we haven't seen any. And Nick, we want your perspective on this, but we haven't seen that being an issue. The language models are such that I haven't seen any issues with clarity being a problem. I don't know. What's your take on that, Nick?
Yeah, so one of the cool things we're doing for Troomi and Trudy is actually tailoring the reading and writing level of the AI to the age of the child that we ingest. Basically, Troomi sends that information to us and we can change the conversation and make it more simple for the younger kids and keep the complexities there for the older ones. So that's kind of how we handle that right now. As far as the voice thing, it's on our roadmap for 2025 to start bringing these voice capabilities to people. I think I've heard a lot of people just tell me that they're excited for a world where they can just kind of hop on a voice call with Elomia or Trudy and walk down the street, walk around their neighborhood on their walks and just kind of talk through some of these things versus having to type them out. So it's definitely on a roadmap. We're definitely thinking about it. And kind of anything we do at Elomia, again, is if it helps the user, if it's what they want, that's kind of how we build. I'm just listening to the people giving us feedback and then adding different pieces that they're excited about. So we try and stay as close. Same thing with Troomi. We try to stay as close to the customer as possible and really figure out what they need and then bring it to life and build it for them.
Awesome. And I know we're coming up, we have a few minutes left, but any like advice for parents that you have that are like just getting started with their kids with the conversation with AI or therapy? Any advice where to get started? What's like a small step that they can take today to help them help their kids as well?
I don't think there's any challenge in, encouraging adoption among kids. Kids are growing up with AI everywhere. So it's commonplace. This is the new wave of technology. It'll be as pervasive as the internet is. And I think my advice to parents, though, be um, look past there's a lot of media sensationalism about AI. The media loves a sensational headline, but dig deeper and really understand what AI is doing, from a mental health perspective. But in particular, start with something that is made for kids, that is guardrailed, that is not going to take kids into conversations that you wouldn't be okay with. And that's what Elomia has helped us do with Trudy. It's safe, it's positive, it's not going to take kids to places there that you wouldn't want them to go.
And I'd add one more piece, and it's kind of what I think might be good life advice for anyone in general is just try it for yourself. Yeah, you can read the headlines and you can learn things from articles, but you never know, their reasonings for writing that article. So if you have the chance to try some of these things, give it a try. We've had many stories of people saying, "Hey, I can't help me with this. I don't even want to look at it. I don't want to give it a try." And then we put a phone in their hands and have them chat with Elomia or Trudy, and they're like, "Wow, this is actually pretty good advice." And then keep chatting with it and not give us the phone back because they enjoyed it so much. Yeah, it's just try it is what I would say.
My partner Dave told a great story the other day. His mom, who's an older lady, was like, "What are you doing? What are you doing with this AI thing?" And he just put it in her hands, and she had this epiphany and just said, "Wow, this is fantastic advice." As she started asking questions, and it was the same kind of thing. She didn't want to give it up, and so that's great advice. Just try it for yourself. That's good advice, Nick.
That's awesome. Do you have like a Troomi for elders or maybe for grandparents? Not yet.
Not at this point, but Elomia would work great for them.
Really nice. We have one more question. Can we get a demo trial for Trudy? How do people get a trial, or is that something that is available?
We're actually talking about this right now. That's something that we're looking to make available and working with Nick and the team on to let people interact and have that demo kind of experience on our Trudy product page where they could ask questions and just experience for themselves. What does that interaction look like? So that's something we're working on. And great idea.
And if you want to just try Elomia in the meantime, you can go to elomia.com or search it in the iOS App Store and test it out.
Really nice. Yeah, I hope this was helpful for all the parents in the room, for everyone in the room that is curious about AI, about therapy, about how to support your kids on a better journey. I know this is not our typical fireside chat, but we did this because we care and we care about people, we care about parents, we care about mental health. We have a channel in our Slack that it's health is wealth. We care about what people are doing to support their careers, and this is part of it. So it's something we're going to continue doing because that's one of the strong pillars that we have to continue to work on it in order to be successful in every other aspect in our lives. So I appreciate Nick for your partnership, for collaboration that we've been doing in the past like a almost 4 or 5 months. No, I think even more. Yeah, I think I met you guys at the end of last year. It's like it's been.
I know it's flying. Time's flying by right now.
And thank you, Bill, for joining us too. I appreciate your insights. I appreciate your feedback and everything that you're doing to keep kids safe. As a mom of three, I couldn't agree more with everything that you said. And how hard it is, especially now to create the guardrails and do the right thing, be in like build a safe space and not keep them alienated from everything, right? And also Joey for being my partner in crime in all of this fireside chats. I appreciate and everything you do for the community and everyone that attended. Thank you for joining us. I'm gonna post the recording on YouTube if you wanna watch it again, or if you missed anything. I hope this was a good use of your 30 minutes, and I appreciate it. Anything else you want to add, Joey or Nick or Bill? You can always add something.
No, well said. And thank you everyone for joining. It was a really fun chat and the
Thanks,
question.
Thank you, everyone. I'll see you
Thanks,
all later.
everyone.
Bye.
Bye bye.